Good morning, everyone. This is Kim Berry. I'm from ALS Canada. Thank you so much for taking the time to join us this morning for our first webinar titled How to Stay Safe at Home and Maintaining Social Distancing. If you're having any questions, please feel free to put them in the chat box. We have somebody monitoring that this morning, and our panelists will happily take the time to answer those questions. First, I'd like to introduce everyone on the panel. First, we have Alan Medcalf, who is a gentleman who has been living with ALS for 4 years and is quite heavily involved in activities in ALS Canada, primarily our CSAC, which is our Client Services Advisory Council. We also are lucky enough to have Becca Chan from the York Region Public Health Department joining us today. She has been working there since 2004 and is a public health inspector. Currently, she is the team lead for the General Infection Prevention and Control and COVID-19 response. That's a big title. And we're also very lucky to have Dr. Tandon, who is the respirologist at the ALS Sunnybrook Clinic. Thank you, everyone, for joining us this morning. I think we're going to get right into the questions, if everyone is comfortable with that. Alan, maybe if we start with you, if you want to give us a little bit of information. And the first question we have is, what can you do well maintaining social distancing in a time where there are so many restrictions?
Well, I wonder if I could broaden the response to that just a little bit.
Absolutely.
When you introduced me, you mentioned that I've been living with ALS for 4 years. I am fortunate to be living in my own home with my wife, who's my primary caregiver. And as a bit of additional context, before COVID-19, I was benefiting from a daily morning PSW visit for assistance with personal activities of daily living. I was able to get outside regularly, meet with friends for coffee chats, enjoy frequent visits from family and friends. I think everybody knows the kind of normal that we've come from. I also, however, used to spend a lot of time at home alone while my wife was out participating in activities that were important to her. Now, since COVID-19 landed, of course, things have changed a lot for all of us. So I wouldn't pretend to repeat the advice that we see every day about physical distancing and personal protection. Your ALS Canada website and the Public Health District Unit websites have lots of material that's kept current, so I would refer you to that. I also am not qualified to comment on any clinical matters, so I'll stay away from that. But there are 4 quick things that I would highlight. One is a reminder that we are each responsible for, and to some extent in control of our own surroundings. And in part, for those of us living with ALS, that means we need to call the shots and set the protocol for who can enter our homes and under what conditions. Shortly after COVID-19 started to really hit the news, I established a protocol with my PSWs. When they stepped in, I greeted them with, "Good morning. Please know that I feel fine this morning. I'm not sniffing or sneezing. I do not have night sweats. I don't feel feverish. How are you feeling today?" And that started our dialogue for the morning. We also have a dispenser of hand sanitizer beside the front door. Disinfectant wipes are always close by. Now, once the COVID-19 activity quickly escalated and we were cautioned about proximity to others, my prime PSW and I sat down and with my wife as well, and we had a good discussion about the risk profile of her visits. And we quickly recognized the risk of her being preclinical or asymptomatic, given her multiple client interactions in a diversity of settings every day. So my wife and I decided together that she would take on the PSW's duties and that I would suspend my PSW service for a while. Now, I'll readily admit that I'm fortunate that I'm able to do that. My ALS is at a stage where it's manageable for us, and I'm able to suspend PSW service for a while. And my care coordinator at the LHIN has assured me that my case file does remain open, and I will be able to resume service later on. Now, of course, I also understand it might take a while to get back to perhaps the same PSWs and the same time slots, but we'll deal with that later. So like I mentioned, on one hand, I'm fortunate that my wife and I are able to do this, and I'm grateful for the support that I do have at home. On the other hand, I also recognize it puts an additional burden on my wife, and she's also stuck inside with me much more than she was before. Now, I'm mindful that not everybody living with ALS has this option of reducing or suspending PSW service. I'm told, though, that the major service providers have ramped up their awareness and protection practices, but I would still remind pals that we call the shots. So insist that those coming into your home take appropriate measures for your safety, and remember, you don't have to let them in. My second comment would be about the challenge of staying in touch with friends and family and others. When we can't be face-to-face and we can't get the hugs and the touch, then we have to revert to the list of things like phone calls, video chats, email and messaging, virtual support groups. They can all help. There are lots of board games online you can play with others. And I'll tell you, you can even open a video chat session so you can razz each other while you're playing. You can do a Zoom in for a beer chat or a coffee chat, even though you can't get together physically. Something I've done is make a reminder list of all the people that I want to stay in close contact with, and I reach out to them regularly. So don't wait for the call, you make the call. My third point is that it's really important to find a way to get outside, especially now that the weather's warming up, things are turning green. While respecting physical distancing from others, you can still get outside for a walk or a push or a roll, perhaps with somebody you're living with. Maybe you can sit in the garden or on your balcony or in the courtyard, or go into the neighborhood, chat with your neighbors at a distance, across the driveway maybe. Smile and say hi to others. It's good for your body, it's good for your mind, and it's good for your soul. So my last comment that I would make is about help from others. You know, one of the tough things about living with ALS is that we lose our independence. One friend reminds me that control is an illusion. And we're all surrounded by others and their offers of help. And I think too often we respond simply with, thank you, I really appreciate that, I'll let you know. Well, now's a good time to be accepting those offers. Perhaps somebody else could pick up your prescription or your grocery order and save you or your caregiver the extra trip and exposure. So those are the kind of points that I would put out into the discussion today, and I thank everybody for joining us. And perhaps there'll be more questions and comments at the end.
Thank you, Alan. Some really great suggestions on how to socially distance without isolating yourself. Becca, one of my questions to you is, a lot of our clients don't have the option to not have PSW support and other healthcare providers coming into their house. What can clients expect from professionals coming in terms of protection, and what should they be doing to protect themselves?
Okay, thanks for the question. Can you hear me well? Okay.
Yes.
So I think that, let's say if a client needs PSW to come in because this is a service that is essential to them, and I would call the agency and ask them, do they have a policy in place right now due to this COVID-19 pandemic? whether you have screening in place, is your client or your staff doing self-assessment before coming in, and then when they're on site doing screening again, make sure everyone less likely to have COVID-19, although some COVID-19 cases are symptomatic. And then hand hygiene is very important. And then also we want to find out employer of those the agency whether they provide PPE to their staff, right? So everyone is different. Every client has different needs. If some client just needs someone to give medication because they live alone, they cannot do it themselves. So the PPE requirement is very different from someone who needs personal hygiene care or some direct care or feeding and stuff like that, right? So having PPE is one other thing. And then they should, I would think that employer or the agent should provide hand sanitizer to their PSW that remind them to clean their hands when they arrive at a client's home, so that in case their hands are contaminated, they're not bringing to the client's home. And then when they finish their task and then pick off their PPE, they should always clean their hands before they leave, so that at the same time, not bringing any germs from the environment to our community again. So that's important. And so I want to say that physical distancing is a very, you hear it anywhere. Media, you read on the news, like you have, like, you know it. So physical distancing is very important. So even for something very similar, like giving medication, because like it's hard to maintain 2 meters and 6 feet apart between client and PSW. So wearing a mask is something that is a new norm now, unfortunately. Yeah. So I would first contact the agency and then ask them what type of, do you have a policy in place? Find it out. What type of measure you have in place, PPE, hand hygiene. Does the staff know how to use PPE properly? If they're PSW, I mean, all this thing, they should be in place even before COVID-19. And then also PSW should be able to conduct risk assessment in terms of how and when to use PPE, and also be educated how to use it properly to protect themselves and also the clients, right?
Perfect. Dr. Tandon, from a respiratory perspective, can you tell us how clients can protect themselves from COVID?
No, thank you. So it's really much along the same lines as what Becca has outlined as well. Is that and what Alan alluded to as well, is that you need to be safe. You are in control of your surroundings, and all the precautions that public health is putting forward is exactly what I would recommend. That's kind of the first step. The second step is that patients with ALS, in particular those with respiratory involvement, if they were to get sick, they would get sicker. And so I think that, while everyone should be following these measures, I think a lot of the measures that Alan was referring to with regards to things that he's put into place to keep his environment safe are key. What some patients on BiPAP or respiratory involvement are going to notice that when they do have PSWs coming into the home, or they do have nurses coming to the home, they should always be wearing a mask if the BiPAP's in use. And so there is that extra layer of protection that we need to be cognizant of if they're on BiPAP therapy as well. But the advice that I would really give is that in the event that you do develop symptoms, all of us are open, and there is this thought that because things are closed, that perhaps we're not accessible. And I would say that I've been on calls with ALS Canada, ALS clinics across Ontario, and we are all running virtually, and we are able to help. In the event that you do develop symptoms, it's really important to reach out early and to have that conversation with your healthcare provider, and also let people know who might potentially would have been coming into the home as well, because you don't want to further expose. But I think it's really important that you reach out to your healthcare provider so we can step in sooner rather than wait till things may potentially get worse.
Becca, is there a lot of our clients have a lot of pieces of equipment in their home, whether it be something for their respiratory support or a walker, lift equipment. Is something like Lysol wipes the typical thing that people should be using to maintain that and sanitize that equipment?
So I assume those equipment belong to the client, right? They are not shared equipment, right? Is that correct?
No, they're not
sharing. Okay, so if it's not sharing, that's much better. That's what we always prefer, right? But because of COVID-19, and then you also have people coming in like essential worker, let's say PSW. So we do, for public health, we do recommend increased cleaning and disinfecting frequency inside the house, those commonly touched area, but also equipment, right? So Lysol wipes, yeah, that's a very good question because you can buy from grocery store anywhere. So in Health Canada website, there is a list of hard surface disinfectant that is effective against coronavirus that causes COVID-19. So you can go on that website to take a look. But if you don't go in, that's fine. But the thing is for coronavirus is an envelovirus. It's an envelovirus, which is easily to be killed. This is the good news about it, right? So for Lysol, if the Lysol product has a DIN number, which is stands for Drug Identification Number. That is a number issued by Health Canada. They look at the label, claim, saying that, oh, you know, when you go to a store buying disinfectant, they all say they can kill 99.9% of germs, right? But how do you know whether they're telling the truth or not, right? So Health Canada comes in, take a look at the label, claim, all the research and study. Oh, yes, they are doing what they promised to do. And then Health Canada issue a DIN, Drug Identification Number. So that means that the product is doing what they're supposed to do. So for Lysol wipes in the market, yes, they are able to kill coronavirus. Yes, so they just have to follow the instruction. So I want to bring it to everyone's attention about using disinfectant properly. If you're using manufactured product, that, for example, Lysol, if the label said that to do disinfection, you have to clean it first. Make sure you clean it first. If you don't clean it first, remove the dirt or debris or oil layer on the surface, that disinfectant cannot really do the work effectively, right? So just follow the instruction. Another thing is the wet contact time. If the label asks you to leave a disinfectant or leave the surface wet with the disinfectant for, let's say, 5 minutes, 4 or 3 minutes, make sure you keep that surface wet. This is a time that disinfectant needed to do the work, kill the germs on the surface. And depends on what it is. Sometimes different chemical has different requirements. Some need to rinse with water afterward. Others just say, oh, just leave it air dry, or after 5 minutes contact time, you wipe it dry, it's okay. So that's why it's very important to follow manufacturer instruction. Also, if gloves are required to use while touching a chemical or the product, please also follow that. Another thing is expiry date. Don't forget that expiry date is very important for disinfectant. Once a product expires, it won't achieve the desired result. So just keep that in mind.
Thank you. Those are really good suggestions, things that not everybody would think about, especially the expired. People are just happy to have anything at this point. So thank you for that. Dr. Tandon, one of the things that's been floating around in conversations is that COVID is spread by droplets. And there's been a lot of discussions about the BiPAP machine, the cough assist machine, the suction machine. And we know that there's the requirements for PPE for healthcare providers. Should families be using PPE when they're supporting somebody at home?
So it's a great question. And so, you know, BiPAP, cough assist, and suctions are all what we describe as aerosolizing procedures, where you are essentially, especially with the cough assist, which is probably the highest risk, if you're literally inducing a cough. And the masks that are used for a cough assist don't necessarily fit completely, which means that droplets will be spewed. Now, realistically speaking, if you are living with your family, and these are people who are with you, and Becca, you can correct me if I'm wrong, but these patients are already in your bubble, and they have already, if you actually have COVID, have already been exposed, you know, if you actually think about it. So I don't think family members who live in the same household need to be masking within each other, because there's no necessary further further exposure beyond what you've already done on a day-to-day, because you haven't necessarily been physically distancing with your family. Healthcare workers, however, this has become a larger issue. And, for any of those individuals on BiPAP therapy who may have had the luxury of having respiratory therapists come into the home or having respiratory nurses coming into the home, often those visits have been scaled down because there haven't been N95 masks available to these healthcare workers. So in these particular circumstances where there's a BiPAP, a cough assist, or a suction device, those three are all further aerosolizing procedures that, in general, IPAC has been recommending that N95s be used for those particular procedures, and that's what we're doing in the hospital. And so that may have changed the follow-up, but no, family members shouldn't need to wear masks, I would think, within the home if they've been living in that same home.
So with more people being exposed to COVID and a lot of clients not going out of the house, I think my question is probably for both Dr. Tandon and Becca. How do people social distance in their own homes to protect themselves, either from someone who has been exposed to COVID or someone who already has been diagnosed with COVID? So, I think Becca is probably the best person to answer this. I can give you we've had a lot of healthcare professionals who have been in a similar situation who have had to self-isolate, either because they're waiting for a COVID swab result or they've actually tested positive. And, I think that's taking various forms depending on what resources are available to you. Some I know have been isolating on one floor in the basement, keeping physical distancing, wearing a mask when they are coming into contact with other family members. They are using different sets of towels, different washrooms, essentially different services, cleaning down those services on their own, and literally isolating themselves into one area of the home and wearing a mask so they can protect others. And that's a key part of this as well, is that mask protects others from you when they are in the vicinity of their own family members. But Becca, I'm going to let you take over from here.
Sure. Yeah, so if someone is carrying or living with someone who has the virus, it's considered a close contact, right? So there's many measures that the household member can do to protect themselves. So, for example, wash your hands often, right? So always wash hands, like with soap and water for at least 15 seconds, or use hand sanitizer, alcohol-based hand sanitizer. Wear masks and gloves when the household member have to provide care for someone who has or suspect have COVID-19, and especially when they know that they have to contact with body fluid or blood, that type of thing. Wear masks and gloves, and of course they live in this household, so social distancing, physical distancing can be challenging. So they should have separate room, ideally separate bathrooms as well, right? And also don't limit number of visitors into the home. If any services that are not essential, just stop it, so prevent further exposure to other people in the community, right? Regarding sharing household items, let's say for dishes, towel and stuff, personal items should always not be shared. And for dishes, ideally have a separate set for each person. And then all these dishes can wash it in the dishwasher and with lawnmower detergent. And regarding laundry, same thing. They can wash it in the same load with hot water cycle. Just make sure before they put in laundry, wear a glove handling the dirty laundry. And then after they put it in their turning machine, just take it off and wash their hands, right? That's important. And environmental services, cleaning, disinfection. So doorknob, doorknob or TV remote control, telephone, those are the commonly touched services. Those services need to be cleaned and disinfected frequently, at least probably twice a day, right? That's very important, because one of the things for the coronavirus, it's spread by droplet, but droplet can land on any surfaces and live there for from hours to days, right? Depends on the environmental factors. So that's very important. So yeah, try to maintain physical distancing, if not mask, because everyone live in a household, and so based on a confined space, so wear a mask. If you have any close contact, and hand hygiene, cleaning, disinfection, those are important.
Alan, my next question is actually for you, and it kind of speaks to this. You're not going out of the home much, but your wife is still doing things. Have you taken any measures that both Dr. Tandon and Becca have suggested around extra use of cleaning door handles and things like that, even though there's only one person leaving your home?
Yeah, I mean, we're lucky that groceries can be ordered online and then picked up in the parking lot. So when my wife goes to pick up groceries, she doesn't even have to get out of the car. She just nods through the window and pops the trunk open, and the groceries end up in the trunk, and she comes home. She will wipe down or rinse off all the groceries as they come into the house. For other things like prescriptions at the drugstore, they are coming out and doing curbside delivery. So she rolls down the window and they drop the prescription bag on the front seat of the car. Deliveries from places like Amazon or others in town, those deliveries that end up on the front step, we don't receive them personally. They land on the front step and somebody rings the doorbell or messages us to let us know they're there. We kind of kick them through the front door into the closet beside the door, and they sit there for 48 hours, assuming it's not takeout food. So they sit there for 48 hours before they get touched. They get handled with gloves on. They get wiped off before they're opened. And depending on what's in there, the items get wiped off as well. So things inside the house get wiped down routinely. I think our practice is pretty consistent for the exterior doors. Only we touch the handles on the inside of the exterior doors, and they get wiped down regularly. And the handles on the outside that others might touch, they get wiped down as well. So it seems a little bit laborious, but you always have to be thinking about who touched that item last, or who was here last, or yeah, I think that's what you were getting at.
Absolutely. Thank you. Dr. Tandon, from a respiratory perspective, is there any concerns with people going outside and social distancing?
No, I mean, and it's interesting because I think public health, the message is to stay inside and to stay home. And, I think that realistically speaking, that can be challenging. And so, I think particularly with my patients who if you're not moving, you can actually get into more trouble. My asthma, my COPD patients, when they're sedentary, that's not a good thing. And so I think that, in general, I can tell you majority of my patients are going outside. A lot of them are wearing masks. And, I think it's been there's been a whole host of literature out there about to mask or not to mask. And I'm not going to get into that because I don't think anyone has a clear consensus as to what should be done. But I can tell you that majority of my patients are masking because they are a higher risk, although the mask is really more to protect others. But I think that patients are going outside, and I think this weekend is going to be challenging. However, I strongly recommend physical distancing. And there's been some more literature about people running or biking, and that when you're running, there's a higher likelihood that anything aerosolized can be transmitted even further. So if you see a runner, literally go to the opposite side of the street And, you know, I think obviously wash your hands, be very diligent about not touching anything. A lot of my patients are wearing gloves and they're putting their hands in their pockets just to make sure they're not touching anything. You know, these are things coming from patients who are finding a way to stay safe but still get outdoors, because I think while, yes, the messaging is to stay in at home, if you need to go outdoors and you need a way to be active, then you just need to take these precautions.
Becca, I think one of the things, I think Dr. Tandon kind of hit the nail on the head with this in terms of we're being told to stay inside, and that's really important. And there was a recent conversation with a neurologist and a patient, and the patient hadn't even gone on their porch in 7 weeks because they were so concerned about the stay inside. And we're equally as concerned about the respiratory system of clients and their physical care needs, but their mental health is really important. And do you have any suggestions around that?
So actually for public health, we do recommend going outside for a walk, but we are not recommending is going to places that's crowded. Let's say like if you do grocery shopping, just do it once a week, because usually grocery store pretty crowded. So avoid going to crowded area, right? But going out for a walk, we encourage that because it's important for your physical and mental health. But what I would recommend, maybe try to go out during the at the time it's not as busy. Sometimes it's hard to predict when you, right? But if that's the case, because all this thing is try to maintain physical distancing, right? If the people going out there, they consider vulnerable population, they're high risk, yes, please wear a mask. That makes you safer. Another thing I would recommend, bring hand sanitizer with you, and also remind yourself, just don't touch everything out there, right? Try not to touch anything. It's quite tempting. And then with beautiful weather we're getting, like it's hard not going out and enjoy the nature. So please do go out, but just make sure maintain physical distancing. If that is going to be a challenge, you know that, wear a mask, and always bring alcohol-based hand sanitizer with you in case your hands get dirty or you feel dirty. Just clean your hands right away, and try not to touch anything. And then when